And thanks to everyone who's tuning in tonight. Welcome. I'm hoping to be as engaging as possible, and I want us to all feel like we're in this together. Your energy, it does come across, and I can feel it. This is where I would typically provide therapy, so this is a very special place for me. So welcome. I'll give you a little bit about my background briefly. I was an intensive care nurse, trauma, a cardiovascular intensive care nurse first, before going back to school to become a clinical psychologist. I'm also a member of the Torrington Medical Reserve Corps, and I'm a volunteer EMT for my town here in Norfolk. Yeah, so I won't go further to that. I want people to feel free to ask questions. If I don't know the answer, hopefully I can refer you to the correct resource, but I will definitely share all that I know. I'm not sure if Paul has the chat function activated, but just know if you do send something in the chat, I can't see it. I'm on an iPad, so you know, I won't be able to communicate in that way. I would recommend emailing it to Paul, and then he could you know, give the question to me. And before we jump into the presentation, I want to give you a little bit of an idea of what we're going to cover. First, I should let you know, I've given this presentation a few times previously, and where I've really been under time constraints, so I've had to go quickly. I don't have that tonight. So if you find that I'm going too fast, Paul or anyone else, feel free to you know, just give me a little reminder that to slow down. But typically I have like 20 minutes to give this presentation, so I've had to really go quickly. So if you feel I'm going too fast, just let me know, and Paul can let me know. So I want to start with two things. These were two things that came out last week, and I'm gonna just share these quotes with you. And it is that COVID-19 has caused the largest decline in the US life expectancy since World War II. The federal government reported just last week, this statistic. It's the lowest level in 2 decades, and there's no modern precedent for it. And the bottom line is that COVID has both worsened and exposed a crisis in the health inequality, and the crisis existed before COVID, and it will continue to exist when the pandemic is over. So just to give us an idea of the level that we're dealing with. Next slide, please. And Paul's going to be my super slide helper. One thing I need to tell you is, as a licensed clinical psychologist, I'm licensed in Connecticut and New York, and actually Massachusetts as well, is that this isn't treatment, this isn't therapy, you know, this is educational only. And if there is something pressing or a crisis, you can see some of the resources and crisis line on this slide. But at the end of the slideshow, I'm going to have you know, a wealth of resources that I hope you all can use, and you'll have access. I think this presentation will be on the website, and you'll have access to what I would say I tried to gather a rich a pool of resources locally and nationally. Okay, next slide. I'm gonna start with the outline, but first, there's a quote. I'll start with a quote by Viktor Frankl, and the quote is, "When we are no longer able to change a situation, we are challenged to change ourselves." And a lot of what you'll hear when I'm going through this presentation today is that's what's driving a lot of the mental health problems, is because we're all being confronted in many ways to change the way we view the world, the way we relate to the world. So what you're looking at now is a little bit of an outline of what we're going to cover. I'm going to start first by reviewing 2 recent psychological studies and their relevance to helping us understand what's driving the mental health crisis in this country and globally. So help us to know where we want to focus in order to help people. And then, because suicide rates are peaking globally, and particularly here in Connecticut, also amongst children 10 to 18 years of age, I've added a suicide prevention piece that I'll have in the latter part of the presentation, and we'll go over that in detail. And between the 2 portions of the presentation, we'll open it up for some questions as well. But I welcome questions anytime Paul wants to interrupt or have questions, but there will be a dividing point between when I do the studies and before I go into the risk factors and warning signs of suicide. And of course, what I hope comes from this is that you know when and where to find help, and strategies that you can help your own well-being and the people around you. Next slide, please. One thing we know, and I've read a few quotes in the beginning, is that we have a wave of grief that's washing over all of us globally, and definitely in the United States. And to help us to understand, to put this in perspective, we know that in 9/11, approximately 4,000 people were killed. We changed culturally how we related to the world. Now, there were other factors, but the loss of life was relatively small, but the impact on how long the country took to recover, I would say, still exists. Another example was the tsunami in Japan. Recently, it was the 10-year anniversary. And in that tsunami, something like between 14 and 18,000 people were killed. And on the 10-year anniversary, they're still grappling with the loss and they're still healing. So just know, I don't have the latest number. Many of you might know it, but I think we're at least at the 600,000 dead mark, which is almost hard for us to actually comprehend. So one thing that we know as psychologists, if we're thinking about grief and loss, is we're going to look at specialists who study grief and loss. So two of the researchers that I'm going to highlight are people who have for decades studied grief and loss, so that they're going to help us to understand a little bit about what's happening. And also that we're thinking of the mental health crisis as the shadow pandemic. Many people refer to it as the shadow pandemic. And the problem with that is that there is no vaccine for this part of the pandemic. This is something that, we have to help our neighbors, help ourselves, because there isn't a vaccine that's going to address this. And if you've ever lost someone or someone close to you, you know that grief isn't a point in time. Grief takes time and years to work through. So there's real work in grief, so that we just have a little bit of respect for what we're talking about here. We're also still in the fog of the pandemic. The pandemic is not over, so that we also keep that in mind as we go through this. Next slide, please. And again, this is just this slide just highlighting some of the things that have been disrupted, ways that we have seen mental health problems increase. Again, and other factors that have trickled down from the pandemic, such as economic instability, digital fatigue from working from home. And as I said earlier, it also highlighted disparities that already existed. Not everyone had room to have a second office in their home. Not everyone had childcare support when there was no childcare. So just to also keep in mind the many aspects that COVID-19 has had an impact on. Next slide. I also want to slide in a bit of resilience here and hope in that the vast majority of us are going to get through this pandemic. We know that just by the sheer numbers. And so I hope that even though some of the research might be disheartening, but know that it is my hope, right, that it's going to give you resources to know how to help yourself, help others, areas where you can make some incremental change in your mental health. So I really want to also to remind everyone that as humans, we are very resilient. Next slide, please. So the first study that I'm going to talk about was conducted by Dr. Lee in last March of 2020. Dr. Lee had experience with SARS. And so when he first started seeing COVID-19 pop up, he was pretty sure it was going to become a global pandemic. And so what he started doing was creating what he calls a coronavirus anxiety scale. And basically, it's a screening tool to pick up on who's in distress, using sophisticated analysis to come up with a simple screener. Next slide, please. And what you'll see here is Dr. Lee's scale that he came up with. So, but before he got to this, right, he did a lot of research. And one of the things that he used was he looked at cognitive factors, which would be things like negative thinking. He looked at emotional factors, things like a sense of dread or expecting the worst. And he looked at behavioral factors, things like restlessness or agitation, as well as physiological symptoms. And through the sophisticated analysis, what he found, which was a bit surprising, is that the physiological symptoms were the ones that were lighting up and were the ones that were predictive of people that were in distress. And when I say in distress, I'm talking about people that were impaired at home or at work, the inability to function at home or the inability to function at work. So we're talking about a level of impairment. And this tool captures it the best. This is now considered a global assessment tool. It's been replicated around the world. It's been translated in over 26 languages. It's used in other research studies. So it's a very helpful tool. If you look at the tool and you read some of the items, you can see they're all physiological, right? So it's things like a lack of appetite, trouble falling asleep, feeling nauseous, lightheadedness. And this was a bit of a surprise because these symptoms are below the level of language. So you may or may not even realize how much distress you're under, right? Depending on how attuned you are to your body. And so this was noteworthy. And it's going to be noteworthy for us because when I go over interventions that might help, we're going to have interventions that address the physiological factors of distress, but also the causes, the root causes of distress. And as I go on, this will make a little more sense. But the analogy that I like to use is it would be, for example, let's say you cut your hand became infected and you were running a fever. So you might take Tylenol for the fever, but you'd really have to address the infection that's generating the fever. So when I go over interventions, I'm going to discuss things that address the physiological distress that will help you to get the, let's say, anxiety that you're holding in your body or the stress that you're holding in your body out, but also the means of things like talk therapy that are going to help you with the deeper issue or the cause. Next slide, please. So in this slide, what we see are symptoms that are associated with the coronavirus. These are 4 symptoms that kind of rose to the top that we saw people having trouble with. And in this histogram, you can see there's blue bars and orange bars. The blue bar would be what we consider the normal amount of distress related to the coronavirus. And when I say normal, you gotta be careful with that word. What we're talking about, it's the threshold before people really can't function at home and really can't function at work. And one of the things about this slide, and this slide has lots of things to be worried about, is if you look at the difference between the blue bar and the orange bar, you see the level of distress, how much higher the people who are distressed are really distressed. So it's noteworthy to see that distance between the 2 bars. I'm going to go over each of them briefly, just to give you an idea of what we're talking about. But these were symptoms we're seeing in people that were rating high on distress with the coronavirus anxiety tool. So the first one is probably the most, I think, at least in my opinion, the most complex of ideas that I'm going to be presenting today. So sort of bear with me. But the first one is called negative religious coping. And basically what that means is what we are finding is people with strong spiritual beliefs, and this could be religious, or it could be something that, I believe in the environment, I believe in the earth's health. They're having real trouble because it would be things like, why is God punishing me? Or we've been, bad to the earth and now the earth is punishing us. It's really assaulting people's belief systems. We're going to get into that later as to how, but this shows us, again, people with strong religious beliefs are having a tougher time, again, because it's affronting what we believe. The next one, which is more straightforward, but even more worrisome, is hopelessness. And the reason to be worried about this is people not seeing a sort of end to the pandemic, right? And we were all experiencing that. And we also know that hopelessness is the primary cause or risk factor for suicide. So it's worrying. We also know that alcohol and drug misuse is through the roof, right? We've all heard how alcohol sales have doubled, probably maybe even tripled at this point. I'm not sure, but at the beginning of this year, they had doubled. We know that drug use has increased. We know just last week, the federal government gave a report that deaths by overdose are up 30%. Part of the reason is fentanyl has been mixed in a lot of the street drugs, but it's also when we're talking about drug overdoses, they're very hard to classify because sometimes we don't know if it was an accident or if the person really was killing themselves. But what we do know is people are self-medicating more and all the implications that go with the self-medication, right? And then the last one And the most concerning is we see a real spike in suicidal thoughts. And we're seeing a spike in suicides around the globe, which is why I added in the second half of this presentation, we're gonna go more deeply into risk factors and warning signs for suicide and what are some things that you might could do. Next slide, please. And at this point, I would like to slow down a little bit for everyone and just think for yourself, what have you lost? And it doesn't necessarily have to be a loss of a loved one or a neighbor, although it could be. It could be something like a loss of childcare. It could be a loss of a significant relationship in your life, a loss of a planned future, right? There were some people planning to retire and travel. That's been lost. A loss of close contact with your children, grandchildren, grandparents, right? These are significant losses. A loss in income, right? A loss of a job. So with respect, acknowledge what you have lost. So next I'm gonna go over, and you can go to so just to take a moment and just tally a bit what you may have lost during the pandemic. Next slide, please, Paul. The last study I'm gonna go over is, again, what Dr. Lee did was he pulled in 2 more research psychologists that specialized in grief and loss, right? So if we know this is the problem, we want people who are really who have been studying it for decades to come in and help us. And what they did is they used standard assessment tools that they use in bereavement, and they added it in with the coronavirus anxiety scale, so we could have a more a fine-tuned look at what was going on. And this is Dr. Millman and Dr. Niemeyer were the 2 doctors he worked with. So next slide, please. And this slide, I'm gonna try and spend some time on this, but this slide tells the whole story. And I'm gonna go through it in some detail and hopefully walk you through it so that you can understand. What they did was they took typical scales we would use as psychiatrists or psychologists that measured anxiety and depression. Some of you may be familiar with them, some of you may even have taken them before. And they also used the coronavirus anxiety scale. And what they found was that the coronavirus anxiety scale better captured the distress that people were going through. And one of the reasons is because of the particular type of distress that we're seeing with the coronavirus pandemic. So if you look at the dark blue bar, that would represent job loss. Okay, people are distressed, but it's relatively low. A diagnosis of COVID, you see that a bit, but again, relatively not that high. A death, a loss of someone from COVID, that's the gray bar. You can see, okay, that starts to creep up a bit. However, if we look at the coronavirus anxiety scale, what it's capturing, you start seeing how it's starting to capture the distress more uniformly. And the 2 bars that we see particularly elevated is the yellow bar, which is meaning making, and I'm going to go back and explain that. And then the blue bar, which is almost through the roof, which is core beliefs. And these are things that people who study bereavement look at. And so meaning making would be trying to wrap our minds around the coronavirus and how much trouble we're having doing this. You can think about it now, how it's ongoing. If we think about the Delta variant, you may be thinking, okay, well, do I wear a mask now if I'm vaccinated? Is that person vaccinated? How do I understand what's happening? Will there be another variant? We're as humans, we're meaning making machines, and that part of ourselves is being assaulted. The other would be our core beliefs. So our core beliefs are things that get us out of the bed in the morning, right? The predictability of life, and the way that's being assaulted. And this would be something fundamental that we hold close to ourselves. It would be something like you would never have thought before that I could go to the grocery store, potentially pick up something that I could bring home that might kill my mother or my grandparents. That is a major assault on your core belief system. So what these researchers helped us to identify was more than typical depression and anxiety that we would look for. You do see some of that. What's really driving a lot of the distress is meaning making and core beliefs. And we'll tie that back in when we look at when the young people who are struggling, that's what they're struggling with as well, right? They're unable to go to school, unable to socialize, and you start seeing what they're grappling with and why it really has taken a toll on younger people in particular. Next slide, please. I chose this image for two reasons. One is Psychology Today is a great magazine. If you're interested in uh, like recent psychological studies, or if you're want to know sort of what psychologists are talking about, it's a great magazine for that. And to be clear, I'm not paid by the magazine at all. It's also a resource online for finding psychologists or a psychiatrist, and I'll go over that. If you go to psychologytoday.com, you can search your zip code and you can look and read profiles on psychologists. It verifies their license, so it's a good resource for that. So just if you're more interested, that might be a magazine that you would like, and it's in everyday language, so it's pretty easy to read and understand. I chose this cover, which they had a few months ago, because when I'm going over interventions, just know that we all want to change, but we all know change is hard. And anytime you're making a lifestyle change, it's difficult. So there is a cost, as the cover says. There's a high cost of calm, right? How do we, when I talk about physiological interventions, meaning things that are going to help us de-stress, things that we're holding in our bodies, it does take an effort. Next slide, please. It not only takes effort, but it takes intention, right? And one thing we know as psychologists is that simple things, incremental changes, are the way you want to start, right? This is how you start folding them into having a permanent lifestyle change. So, watch, and when you're helping others, you know that you're not setting the bar too high, but little things. And I like this slide because it has a lot of nice, simple things you could do that could really help your mood on a day-to-day basis. But that it's not effortless, right? It's with mental health, we often have the problem of not seeking treatment, not talking about it, right? It could be related to stigma, many factors, barriers to care. But we really want to, if I had any message to all of you today, it would be to do something to help yourself. And I hopefully will give you some choices and some range of options that you could use. Next slide, please. So what I'm going to talk about now are the things, or if you look at these items that are on this slide, these are all things that are going to help the physiological symptoms. In my analogy, this would be like, the fever that you're running. Any of these are really going to be useful to you in addressing the tension you're holding in your bodies. I'm going to just focus on a couple. And one is physical exercise. We know for mental health, for mental wellness, we know that physical exercise helps. So whatever, if you're able-bodied and you can exercise, it's a really good idea. Tai Chi in particular is a low impact exercise, but has a high impact on mental wellness. So that would be something, if it's available in your area. And I know I heard even in Norfolk, there was someone that was running Tai Chi classes. It can be a really useful tool. And any of the other things you see, such as mindfulness-based stress reduction, controlled breathing, easily online, you can find, if you were to Google these terms, you can find some really helpful either YouTube videos or like for meditation. I think one of the popular ones is called Headspace. And these things are at your fingertips. And also, if we think, because we were seeing a lot of the physiological symptoms were below the level of language, somatic work or body work and art therapy are things that could be really useful. And now many people would say, well, but I don't do art, I'm not an artist. I know a group of people who have met every Sunday during the pandemic. They get together and they have one art project, a simple art project, whether it's doing a collage or painting. And the way that can help is it can get what you're holding in your body out, right? It's a way to express what you might be thinking or feeling that you're not necessarily aware of. And those are really helpful in times of this uncertainty, when you're grappling with meaning making, when you're grappling with having your core beliefs assaulted. Next slide, please. And then we'll talk, I am a psychologist, a treating psychologist, a little bit about therapy and getting rid of hopefully reducing some of the stigma and some of the myths about therapy. One thing we know is that if you're struggling with making meaning, if you're grappling with rearranging your core beliefs, talking with someone else helps. And therapy, having someone who specializes in talk therapy is going to even be more efficient. And one thing we know is that it doesn't matter the style of therapy. Any talk therapy is going to help you. The other thing that we know through all psychological research, the best indicator for a positive outcome in treatment is your relationship with your therapist. So the therapeutic relationship. So you want to be with someone that you trust and can build a relationship with. That is the number one indicator that you're going to have a good outcome. And again, there are many different types of therapists and different backgrounds. At some point, I'll go over that a little bit. But again, it doesn't have to mean you're crazy. It doesn't have to mean something's wrong with you. I hear often when someone really needs help, oh, but I would never go to a therapist because that would mean something's wrong with me. Whereas if you had a broken arm, you would never say, well, I'm not going to go to the doctor and have my arm set because that would mean something's wrong with me. Mental health, there are still stigma that keeps people from reaching out. And it doesn't even have to be necessarily a professional if you wouldn't be ready for that, but a close friend, a neighbor, but to talk to someone, to not isolate. Next slide, please. And again, this is just repeating a bit of what I had said earlier. Again, giving you time to reflect, to think with someone makes a huge difference in your mental health. And I always tell people, I believe in therapy is the equivalent of going to the gym. So if you're going to the gym to be physically healthy, seeing a therapist is going to promote your mental health. And I can tell you, all of my patients are high functioning individuals, with either they're in college or they have big jobs, degrees, and they see me to improve their mental health, to improve their interpersonal relationships, which are important at work and in their home life. So again, this idea that it doesn't have to be some horrible issue. Though if it is that, there are professionals out there to help you. Next slide, please. And again, to remind us all to support others, right? To check in on your neighbor, to check in on that relative. Sometimes a simple phone call can make all the difference. To just ask someone how they're doing, right? To offer them some support. We are social beings. And this slide is just a reminder of how powerful that is in helping us through the pandemic, and certainly is a robust factor in preventing or mitigating some of the suicide risks. Next slide, please. These last slides I'm going to show you are kind of for your information. If you want to know more about the Coronavirus Anxiety Project, if you want to know more about what Dr. Lee is doing, that's what these slides are for. So I'm just going to kind of go through these quickly. Next slide, please. Here, I just wanted to thank Dr. Niemeyer. He shared some of his slides and his data open and freely, and great gratitude to him. And if you wanted to get further into work with grief and loss, and you were okay working in teletherapy, the Partland Institute for Loss and Transition is a wonderful place to go for some resources. So next slide, please. And this is references of some of the studies I cited, and it's in the journal Death Studies, which is a bit grim, but that is what they study. Next slide. And this is where I'm going to take a little bit of pause, maybe answer some questions now before we go into the section on suicide. I did cover a lot of ground. You may have some questions, so I'll just open it up and maybe see where everyone is.